And I think we're live, Miss Sarah.
Wow, I'm so excited. Well, thank you so much, Sharon. I feel like this has been a long time in the making. Two women who love to talk, to each other, who love to talk about our life and our experiences, and who love to advocate on behalf of other people. We're always meeting people, we're always reading things, and it feels like this is such a natural way to express what we're learning and how we want our audience to engage with things that are not just important to us, but important really to moving cancer care forward in a way that's meaningful to others. So I can't wait to do this. These tea talks are designed to be 10 minutes long, give or take a few minutes if the conversation gets robust. We're going to be taking questions from the audience at any time. And so I wanted to just give a little bit of background on how this came to be. And it really started from Sharon and I talking about how do we talk to people? How do we get people to know what we're doing, who we are, why to get involved, how to get involved, and really to start to meet the people that power the things that we do. So Total Health is the largest provider of free oncology medical education in the United States. It's a banner that we hold really close to our hearts because we've worked hard to achieve it. We educate tens of thousands of learners every year. These are learners, physician learners, nurse practitioners, PAs. And most recently, we started getting into the advocacy realm where we have a lot of advocacy organizations represented on our panels. So what would be a way that we could start to kind of get that information out? And we thought, why not talk about it? Why not get on our social channels and talk about it? So we decided to call it Tea Talks. One, because we want to take a 10-minute break of tea with you or coffee, whatever you have, or something else, whatever you have in your cup. But we wanted to call it Tea Talks because it needs to be a place where you could spark your joy, where you could get your happiness, where you could learn how to be empowered and how to make change in your own life. And T cells are the cells responsible for fighting off the things that are trying to hurt us internally. We have research and studies that show that when you activate the power and the consistency of T cells in your body, it leads to better health outcomes. That's why taking a walk, being with family, eating delicious meals with people, all give you a sense of feeling better. So that's a little bit of intro of what we're doing here. And now I would like to intro who we are. So Sharon, tell us a little bit about who you are and why you're here and how you intend to impact our community with the things you want to share.
Awesome. Well, again, welcome to Tea Talks, everyone. I'm a tea and a coffee lover. So how appropriate is this name? And so Sarah and I actually, we've known each other for about 30 years. And so most recently, I was made head of community engagement for Total Health. And with the intent that I was going to, help to, as she said, bring the message of who we are and what we're doing in this space right now to the community. And I want to back up a little bit how I got reconnected with Sarah, which was about 15 or so months ago. I was diagnosed with early stage breast cancer. And I remember, ding, 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 expert on this, Sarah. So I called up Sarah and, she was gave me some guidance. And I began working with her and her team and seeing the work that they do in this community, what they're doing in oncology, the education. For me, it took the fear of a terrible diagnosis away because I'm actually seeing, and one of those people who are on the sidelines was saying there was nothing going on in cancer. They knew no research is going on. There's nothing happening. It's just a money-making venture. When I got involved with Total Health, though, I realized I was so wrong because there was so much being done. And when I was given the opportunity to come on board as a more integral part of the team, I said, yes, I'm so there. And I want my legacy at this point in my life, as Sarah said, we both love advocating for women and those who are maybe marginalized, less fortunate, disempowered. We love advocating for them. And this is, for me, at this point in my life, just the best platform for me to do so. So I'm looking forward to it.
Me too. I think it's just everything that you're saying about, you're a person living your life.
Yeah.
And you're going to Target, you got a grocery store, whatever. And it's like you go for a checkup or you're not feeling well or something provokes your visit to the doctor. And the statistics are 1 in 3 people will be diagnosed with a cancer in their lifetime.
Yeah.
I sat in an audience once where the speaker was giving these statistics and said, look to your right, look to your left. 1 of the 3 of you will have cancer in your lifetime. It was so sobering because it was just like, you think of cancer as who has cancer in my life? I actually still always say there's heart disease in my family. Like what's going to take me out is a heart attack. But we don't know this. Like cancer is not about, I should say cancer is not only about the genetic line of who had what in your ancestry. There's so much more. And as we experience younger people being diagnosed with more aggressive cancers, 30-year-olds, we were just at that program in Memphis with the West Cancer Center where one of the doctors said one of his patients is 26 years old, colorectal cancer. It's like, what? So I feel like now is the time where we have to use our platform and our voices to start to almost encourage people. It's not about encountering the diagnosis. It's about understanding your risk, mitigating that risk by what you eat, how you move, how you live, being aware of the things that contribute to a cancer diagnosis in your life. Because 1 in 3, I mean, that's a big statistic. So Sharon, I love that you shared, before the diagnosis, this is what you thought.
Yeah.
And then after the diagnosis being informed, this is what you now know. I think it's so important to be able to advocate using that voice.
Education is key, which is what I like about the work that we do. Because, for example, I always thought, well, if I don't have breast cancer in my family or any type of cancer, I'm safe. I'm going to be going out with a heart attack or something else, high blood pressure or something else that I know is in my family. So that was a big wake-up call for me. And what I'm hoping that this show, which we're planning to do, maybe 3 times a week, can do for the audience is to educate you guys on just the word of it, right? Not to bring scare to you, but just to educate you. Another thing that I'm hoping it would do as well is to, as Sarah mentioned, 1 in 3 people are going to get this, right? Whether it's you or someone in your family. How can we take the big teeth out of it? How can we take that boogie, like, okay, I'm done, I'm dead. No, and put more hope into it. And that's kind of what we want to sell here. Hope. And not okay, this is a death sentence, but there's hope. There's things going on. And we are hoping to bring that to you through our little Tea Talk show here each week.
Yeah. And it's not like, all of us have our favorite podcasts. This isn't that. This is really like the vibe of it is you run into someone at a coffee shop or at the airport or at a conference for many of us that work in cancer and cancer education. You're like, oh my gosh, I haven't seen you in so long. And maybe that person says, oh, I would like you to meet my boss. I'd like you to meet the head of, this particular advocacy organization. And you only have 10 minutes. You have this short time to be able to kind of communicate who you are, what you do, who you serve, why it matters. So we really also want to encourage our listeners, if you're involved in advocacy on any level, and don't put the label advocacy as like, it has to be a nonprofit organization, but you could be a pharmaceutical rep, you could be a physician, you could be a patient, survivor, thriver, you could be someone with metastatic disease, someone involved in, in wellness. Reach out, send us a DM. Like, we want to run into you. We want to be able to bring your voice to this platform to show all the facets and dimensions of what's involved in the cancer care ecosystem. So on that note, put in the chat who you are, where you come from, kind of what's your passion, what do you do? Because we want to call on you to join us. We're going to be meeting, 3 or 4 times a week, 10 minutes a time. you can pop on and see who's talking to us if you're interested. And it's a nice little breakaway in your day too, where it's like cutting through the work from home or cutting through the noise of being in the office or in the clinic. It's 10 minutes. Plus you can catch us on the replay. So I think it's going to be really cool, Sharon, how this thing evolves and all the people that we get to meet and share stories with.
I agree. And I know we have some good people teed up, for our next few lives. But I'd love to get one question from the audience, just one. Who would you like to see on? What would you like to see us cover in future talks? Like I'm here sitting drinking green tea, for example, right? Now, I never liked green tea before my cancer diagnosis, but it's one of the things that they tell me, drink 4 cups per day, because it's very good for breast cancer. So it's little tips like these that we want to arm you with, as you're on the journey. Or you may know a sister or a friend or a colleague on this journey. And so, this is going to be a two-way conversation, not just me and Sarah, but me, Sarah, and you as well. So we'd love your input.
Yes. And next week, we're going to have a breast medical oncologist on the show. She'll pop in for a few minutes during clinic to take your questions on breast cancer and ask her anything. I mean, again, these are the platforms where whether you're, a patient going through treatment and you have someone to ask questions with or to, or you're a caregiver, or you're just involved in breast cancer advocacy or sales in any way, this is the time to bring, questions about the things you want to know the most about. So we'll have a breast medical oncologist on next week. I'm excited too, because we're going to have wellness experts, exercise therapy people. We're going to have advocacy leaders on, patient survivor stories. One of the things I learned from Sharon was the power of those survivor stories. Sharon herself tells a story. We'll post it on our pages. I mean, very, very, very incredible, her story in terms of how it motivates and how it helps you identify with a person going through a cancer diagnosis. So exciting to see how this rolls out. At the end of the day, it's here to be the breath of fresh air that you need. It's here to motivate and activate those T cells in your body. We're here to laugh with each other, to kind of celebrate life with each other. So right now, Sharon and I look amazing. We put our lip gloss on for you. But in future episodes, ladies and gentlemen, we may come to you in our work from home outfits, our sweatpants and our sweatshirts with our hair up in a messy bun. It's meant to be encountering you where you are and you encountering us where we are. So looking super forward to it.
Well, this was fun, ladies and gentlemen. And we're going to let you know that you can put your comments in the chat. Even though we're going to be off air in a few seconds, we will monitor comment and we will respond. So our next time that we're planning to be on is next Monday, maybe around the same time, but we'll give you some notice. So until next time, it's tea time with with Total Health. Take care.
Bye, everyone.
Bye.